Today, we're going to talk about the history of birth. And oftentimes people will ask me, why are we talking about this? I let them know that we have to understand the influences that history has had on our philosophy of birth and how we got where we are today. There was no formal training on birth until about the 18th century. Births were done at home. They were attended by women, generally family members, friends, midwives, and only on extreme emergencies were male physicians called to the bedside for birth. Interestingly, there are a few stories of cesarean deliveries as early as 1500s where both mom and baby were surviving. Prior to that, all cesareans were done post-mortem after mom had passed away in an attempt to save the baby's life. Anyway, in 1762, Dr. William Slippen Jr. went to London and Edinburgh to get formal training in midwifery. And he brought that information back here to the United States to establish his first OB practice, where he started training others in both midwifery and OB. By the 19th century, more and more women were choosing to give birth in the hospitals. With things like bloodletting and anesthesia for pain, they gave ergo for contractions, and forceps were used, sometimes even prophylactically, which means before you even needed it. In the 1800s, sutures were starting to be used to repair any lacerations that happened during birth were left untreated prior to that. Unfortunately, not many providers were well trained in the use of these interventions and often caused more severe issues. By the 1940s, even though more women were giving birth in the hospitals, there was no difference in the risks and benefits of a hospital birth compared to a home birth. Think about it. Back in the 1930s, only about half of the US births were taking place in hospitals, but by 1955, this had risen to 99%. And then twilight sleep came into the picture. This was created over in Germany. It was a combination of scopolamine and morphine. The scopolamine was an amnesiac, and then the morphine helped prevent pain. And they monitored those really closely so that the woman wouldn't experience pain and then wouldn't remember her birth experience. But once it came over to the United States, unfortunately, it wasn't monitored and used in the same way. Here, they had a high demand for it. And because there weren't enough providers trained in the proper use of it, they just started using the same dose for everybody, regardless of their weight or where they were in the labor process. And so because of that, it really caused a lot of traumatic issues and a lot of deaths too because of overdose. So it's really interesting. Google twilight sleep and you can look at more of that information if that's something you want to do. But by the 1950s, women started to fight to have their own care, like a say in their own care. They wanted to have their spouses there with them because prior to that, they couldn't even be in the room. And so they fought against twilight sleep and they wanted to have more choices in their care and they wanted to have their spouses there. And so they started to really advocate for that. So can you imagine not having your spouse with you or support person with you when you gave birth? You just went into the hospital to have a kid alone. So things like this have changed through the years. Those people advocating for themselves has really helped you have a better option for birth experiences because they did the work. And so now you advocating for yourself can potentially help shift and change the birth culture here in the United States as well. So these things are interesting. It's quite fascinating when you realize that how far we really have come and how far we really do have to go still. It's really fascinating to talk to family members and older people and learn about their birth experiences and how was their relationship with their provider and did they feel like they had a say? And also to talk to people who have had different birth experiences in different settings, like have a conversation with people who had hospital births versus home births or even birth center births. So my encouragement to you is to continue to learn so that you can decide what are the things that you want to advocate for yourself, because we really want you to put things on your birth plan that are important to you and that bring value to you. Don't put things on your birth plan that just, that are common on birth plans just because they're there. Put things on your birth plans or preferences list because those are the things that you value and those are the things that you feel are worth fighting for, okay?